Hello, Dr. Andy Hall. I would like to give a presentation and have a little discussion on laser selection. This discussion is geared for doctors who are either shopping for a first-time laser or those doctors looking to trade up. I have facts and opinions I'm going to offer. I'm going to give you a little bit of CV on my laser background. I had the second class 4 laser in the entire western United States. Right after the FDA had approved lasers for use in the United States. I also credentialed doctors for several years from Southern California to Reno, Nevada, all the way to Portland, Oregon. I did that for a long time. I found that very satisfying. I've also taught a 3-hour laser seminar course for continuing education seminars for chiropractors. I've done that many times. So I've used a laser in my practice for 17 years. I've pretty much been around the laser block. I have a outline to kind of keep me on track. I have a tendency to ramble. I don't want to do that, and I don't want to have this turn into a 3-hour seminar. But I do want to kind of hit the high spots and discuss some things that I feel is very important. So there's been a change with use of lasers. When we first started 17 years ago, it was for musculoskeletal problems and some select neurological problems, and that has all changed. Now we're looking at laser use for life-threatening diseases. I have one of them. I was diagnosed with idiopathic pulmonary fibrosis 6 years ago. My original prognosis was to be on oxygen in 4 years and dead in 6. I started using laser therapy right away, and many of my aspects from my last pulmonary function test are actually still better than the very first one I had. My oxygen levels still run up into the upper 90s, which is excellent. So I was supposed to be on oxygen in 4 years, which would have been 2 years ago, and actually I was supposed to be dead by now. No rigor mortis. So we have seen a big change, and now we're also using laser for other internal organs. We're using it for conditions like constipation, female issues, endometriosis, ovarian cysts, things like that. So things have evolved with laser. It's just not for musculoskeletal conditions anymore. Now we're using it for conditions that really and truly are life and death, like for myself. I have started a laser research project for pulmonary fibrosis. I have a lot of patients enrolled in. I have referred over 350 pulmonary fibrosis patients to providers all over the country and frankly on every continent in the world. So we are seeing much the same results with these patients using laser therapy as for myself. I think my wife, she tells me that I'm obsessed with laser. I prefer the term enthusiastic. I still have a lot of enthusiasm, but you know, when you have serious conditions like this and you see such amazing and wonderful results, it truly is incredible, and how could you not be enthusiastic about it? So I am very big on that. Let's talk about the two fundamental lasers that are for therapeutic benefit. We have a class 3 laser, which is a laser that goes up to 500 milliwatts. We also have a class 4 laser, which is 500 milliwatts and above. We see Suma's P4 model go up to 24 watts, but yet you can dial it down to as low as a half a watt. So not all conditions require 24 watts. What we need is the proper wattage for the situation. I once had a doctor with a class 3 laser who said, well, I read the report you suggested. It was a research report done on mice. They used 30 milliwatts. And there's actually been 2 research studies done on mice. Both of them were very positive using laser. And he said, but Dr. Hall, they were just using 30 milliwatts and the mice did great. Well, that's absolutely true. But mice have a lung field smaller than my thumb. And you compare that to a human lung, well, it would be inappropriate for us to use a minimum of 10 watts like we suggest on a little tiny mouse, and it would be just as inappropriate to use 30 milliwatts on an adult lung field. So, that argument really doesn't fly. The problem is with class 3 lasers is that they have very low wattage. Many of them run about 30 milliwatts. I was doing a check for an IPF patient that was not responding to laser, and she contacted me and said, I didn't want to bother you. I thought I would find a laser provider on my own, and he's got a laser. I took a picture of it, and I would like to have you kind of check it out and tell me why I'm not responding, and I did. I looked at the laser that the doctor was using, and it was 7.5 milliwatts. We're not talking 7.5 watts, it was 7.5 milliwatts, which is just getting just past the cutaneous laser layer. As a matter of fact, that's actually less power than the laser pointer that I own. So the doctor spent a lot of money for that laser, and he would truly have done just as well with a laser pointer with the correct wavelength. So I am really big on class 4 lasers. I really feel very strongly that a doctor in the market for a laser needs to get a good laser. When I bought my first laser 17 years ago, it was the best laser on the market at the time, and it was $20,000. And when I bought it, I was hoping that I would at least get a return on my investment. As it turned out, I had all kinds of referrals. The results were absolutely jaw-dropping in most cases. We had really great outcomes with it, and the referrals just wouldn't stop coming. I was so busy with my laser side of my practice. My laser was actually paid off in less than 3 months. And when I first started again, I was just hoping I would get a return on my investment. That was a lot of money, especially 17 years ago. So I find that very important. The other thing I would like to discuss is treatment time. So I'm going to demonstrate on the Sumus laser in a few minutes different protocols for different conditions, and you're going to see how short some of the treatment time actually can be. When you are using a class 3 laser, your treatment time can run a half an hour, 45 minutes. In the case of pulmonary fibrosis, it takes 18 minutes even with the best laser in the world. For a class 3 laser, to get the correct number of joules in there, even if you could get the laser beam deep into the lungs, which you cannot, it would take hours to do a single treatment. So what I want you to do is make sure you do your homework when you are shopping for a laser. I feel very strongly about that. When I was teaching at seminars with my 3-hour teaching program, every time I taught a seminar, I would ask for a show of hands, which doctors in the room have got a laser? And I would interview them, and I'd say, well, what laser have you got? And I'm not going to mention manufacturers' names. Most of the doctors were using class 3 lasers, and we've all heard the name of the company, and again, I'm not going to mention names. But I said, well, how are your results? And they said, well, for some things, good, but for the most part, my results are inconsistent. And The truth is that most of the time my laser sits on the shelf. I just don't have time to use it. I don't have time to pay staff to do a half hour, 40-minute treatment. And, frankly, it's a bit disappointing. The other doctors that would raise their hands, I would say, well, what laser are you using? I'm using a good class 4 laser, and my results are very consistent. I have great success with it. I have a lot of referrals, and my patients are very enthusiastic about it. I've actually made a lot of money, and I got a return on my investment much, much quicker than I thought I ever would. And this is the difference between class 3 and class 4. Please, I am sick and tired of having my chiropractic brothers and sisters getting ripped off by some slick advertising campaign from some class 3 laser company. I don't like it, and it makes me rather angry. I had other doctors in the room that had contemplated buying a laser, but they looked at the price and they said, we're talking $20,000, $30,000. I can't afford that. But the truth is it is actually very affordable. I want you to consider this. So you're looking at an expensive laser. Say, for example, in your area, fees are $45 per treatment. Some areas of the country, fees are going to be much higher. If you're in Manhattan, you're in San Francisco, you're in a very high rent area, all of your fees for adjusting patients, laser treatment, all of your fees are going to be much higher. So fees vary around the country depending on where you're at. We do want to charge a reasonable fee to the patient. But frankly, looking back, when I got my first laser, I'd already been in practice for 30 years. That was 17 years ago. I looked back and I couldn't even imagine not having a laser. I thought of all those cases I could have treated in the previous 30 years with a laser. I didn't have the opportunity. Yet in Europe, laser was mainstream for 30 years. Then the FDA finally approved laser for use in the US. And frankly, I was a bit upset that they waited so long to approve it here, and I'm still not real thrilled about that. But let's just talk about finances for a minute before I get into wavelength and power and modulation and all those things. And we're just going to kind of hit the top of those issues. But let's discuss the finances. So these doctors say, "Gosh, I can't afford a laser like that." Well, let's just say, for example, we're going to charge $50 per laser treatment. Say you use the laser just 5 times a day in your office. So what is that? That's $250 a day. If you work 5 days a week, then you're looking at $1,000 a week. For a month, that's $4,000 income per month. If you go and take an equipment loan out, $4,000, if you can't cover your equipment loan with that, then something's seriously wrong. You're going to have a fraction of that. So you're going to be making a payment on your equipment loan, but you're going to have a huge profit to boot. So I don't want to hear the argument from doctors that these lasers are just too expensive. I'm going to lose my shirt, because that is absolutely not the truth. The truth is you're going to make a lot of money. You're going to use the best laser you can. And I have always said at seminars and other doctors that there is nothing more expensive than a cheap laser. They cost you. And the reason why is because with a cheap laser, you don't get the success with it. You don't get the outcomes that you would get with a class 4 laser. You don't get referrals. And you're right, there's nothing more expensive than a cheap laser. Always get the very best laser that you can get. And in my opinion, this is the laser right here. It's the best laser on the planet. And we're going to show you some things on this laser here in a few minutes. and you'll know exactly what I'm talking about. So let's discuss power. Again, a class 3 laser will go up to 1/2 of 1 watt. That's 500 milliwatts. Good lasers, you're going to have at least 10 watts of power. Again, the Siemens laser P4 model is going to go up to 24 watts. We don't use 24 watts on everything. Sometimes it's just very inappropriate. This laser will actually dial down to 1/2 a watt. So what you need though is power which drives the photons into the tissue. So a class 3 laser, most of them are only going to go maybe a few millimeters into the tissue. The truth is, a lot of the class 3 laser companies have kind of fessed up and they said, well, yeah, we don't get good depth of penetration, but what we rely on are the secondary carriers. What's that mean? Secondary carriers. That means that they're relying on the blood and the lymph to carry the photons to the target tissue, whether it be a lung, a meniscus, a rotator cuff, or whatever. How about it? Let's look at that. Let's look at a disc, which has a very poor blood supply to begin with. You don't have blood vessels on the surface of the skin that have a direct line into the disc. Same thing with your lymph. That doesn't happen. So really, a lot of that for a lot of your tissue is just nothing but nonsense. But some doctors buy into it. They go, oh, secondary carriers. Okay, well, I guess that's good. And other companies will say, well, we have the best laser because we have a wavelength that has deeper penetration than other wavelengths. And you know what? That is absolutely true. However, it's still a class 3 laser. You don't have the power to drive that wavelength as deep as you should. Sometimes we treat superficial conditions like shingles, acne, that type of thing. There's other orthopedic problems, some musculoskeletal problems like epicondylitis. You know what? The truth is, class 3 lasers have helped thousands of people all over the world, but they have limitations. So you can take a class 4 laser and you can dial it down, but you can't take a class 3 laser and dial it up. And what we need is the proper dose to the target tissue, and that only happens with power. So power is extremely important when it comes to laser therapy. Let's also talk about wavelength. So there are different wavelengths that are specialists. They do different things. Many of the cheap lasers have one wavelength, and the company will say, yeah, but it's the perfect wavelength for everything. Well, in my opinion, there is no perfect wavelength. Let's look at what the P4 model has. We have 4 wavelengths. We have 650 nanometers, which is especially good for surface healing. So we don't have great depth of penetration with that particular one, but it's great for surface issues, cutaneous issues, that type of thing. 810 nanometer wavelength, that is especially good for ATP production. So again, these wavelengths are specialists. They have their specific functions. 915 nanometers enhances oxygen delivery. Ask me if that's important. Very important. 980 nanometers improves the circulation. So again, that's another important thing. If you have an injured, damaged tissue, oxygenation is going to help heal that tissue along with the production of ATP. So that is very important for our clinical success. If you want consistent outcomes with your patients, it's going to require a good laser. Let's talk about modulation. This is one of the other things that I feel is very, very important. So modulation is basically your frequency. It's the hertz. So it's how many flashes per second of the laser light occur. The body responds to different modulations, and some modulations, some frequencies are best for pain, some for inflammation, edema, oxygenation. Some are better for antimicrobial needs and that type of thing. So for the IPF protocol that we have, there are actually 10 modulations, and some of them are very, very specific. So when you are shopping for a laser, you want to be able to adjust the modulation very specifically. So the protocol, for example, for IPF, we have circulation, lymph, 587, lungs, bronchial, 727, the inner skin, 584, lymph B, 292, optimization of cell activity, 2,128. You have difficult healing, and this can be for some of your other patients too, 17,024. So we have very specific modulations. Most of your lasers out there are not going to do that. And again, I want to talk about some of the class 4 lasers. They're not all the same. Again, a class 4 laser that's over maybe 500 milliwatts, that's not going to cut the mustard for treating lungs. We need a minimum of 10 watts to get into the lung fields. So a 500 milliwatt laser is not going to do that, and it's not going to provide the fluence that we need for these people with a deadly lung disease, let alone a disc. You know, you want to get photons all the way into a disc. It's going to take some wattage to do that. So it's important that we have good power, we have good wavelength, and we have good modulation. You have to look at the whole picture. There's so many different aspects of what's going on with a good laser, and I am really big on good lasers. So let's talk about serious conditions. We're talking about pulmonary fibrosis. We're talking about disc problems. We're talking about problems that may interfere with the patient's work, their play, their sports activity. I think that oftentimes as a doctor, we may not think of a serious condition and define that like a patient. Let's provide some examples. I'm going to tell you a few stories. So, for example, we got this young lady, she's beautiful, and she's the homecoming queen. Homecoming queen. A week before homecoming, she develops this giant pimple on her face, and it was awful. It was terrible. You could see it from a mile away, and we wouldn't generally think of a pimple as serious. I would like to have you ask that young lady if she thought it was serious. No, she was mortified. So we used the laser on her pimple here, and within a week we had all but totally gone. And what tiny residual was left, of course, covered up with a little bit of makeup. But again, pimple, serious for her. I would also like to tell you about a pitcher for the New York Yankees came to see me. He couldn't throw 3 pitches, and he was done. He had lateral epicondylitis, tennis elbow. 3 pitches, that's all he could do. And here this gentleman had worked his way up all through the minors. Pitcher for the New York Yankees. He made the big leagues with a great team. So he came and he was very distraught. He said, man, I'm going to have to retire. My whole career is gone. I can't throw a pitch. So I said, well, let's see what we can do. Began to laser him, and I said, look, for the next few days, don't be throwing the ball. Okay, let's give it a rest. We'll give it a little bit of exercise. We want to kind of work the elbow some, but let's use some laser on it, and we did. And a few days later, after about 3 treatments, he came back. He walked into the laser room where I was. He stared at me. I thought, what's going on with this guy? He walked over, picked me up, shook me like a rag doll. It was crazy. He says, you know what? Last night I threw 100 pitches. I had total control of the ball. And look, today it's not even tender to the touch. You have saved my career. Not only that, you got to pitch in the World Series, and they won. On the off season, he came into my office and said, I want to show you my World Series ring. Very happy guy. Let me tell you also, as long as we're talking, let me talking about epicondylitis. Is the new mom with a brand new baby. She can't even hold the baby to nurse. Ask mom if that's a serious condition. That was serious. I also want to talk about another patient who came in. We had a chiropractor in a nearby town. The doctor's mother had this terrible auto accident, and she fractured her atlas. She was going to an orthopedist in Modesto, as a matter of fact, and she was wearing this horrible, hard cervical collar, couldn't move her neck, fractured C1 in 3 places. The lady was very unstable on her feet. She used a cane. When she wasn't using a cane, she used a walker. She had a tendency towards falls. And as we know, a C1 fracture in 3 places, 1 hard fall, and it could have killed her. After 3 months of seeing the orthopedist, there was no healing whatsoever. She had a non-healing, multiple fractured atlas. And so the chiropractor sent his mom into us, and we started using laser. In 3 months, it was completely healed up. So she had gone 3 months with no healing whatsoever, and 3 months of coming in. They were able to take her out of the long-term care facility where she was, and she was able to go back home where she wanted to be, and she was back in her comfortable chair. She could sleep in her own bed. She could go make her own meals in her kitchen. Another very happy patient, and another very serious problem. And I can tell you all day about patients and wonderful cases, amazing things that we've seen using laser therapy. I mean, all day I can talk about this stuff, and I will stop there. So, serious conditions require a serious laser, and serious lasers don't cost, they pay. So again, nothing more expensive than a cheap laser. Get the very best laser you can get. And I'm telling you that it's going to pay off. You know, I refer IPF patients to doctors literally every day. And I discuss protocols and different things with doctors every day. As it happens, just yesterday, I had a doctor from Naples, Florida, contact me. She wanted some clarification on some of the protocol for IPF. And I said, well, I gave her the clarification, and she said, oh, she's got this P4 laser from Sumas that she loved. And I said, if you don't mind, I would like to share this part of your email. And she said, sure, you go ahead. I'm not going to read the whole thing because it does have patient name, and I don't want to violate HIPAA laws and that type of thing. But I was not planning on upgrading my laser, but injured myself in a golf outing at my Florida Chiropractic conference last August. Did a demo at my Florida conference last August, did a demo on my swollen and injured wrist with the P4 and was blown away by it. The P4 is bigger, better, more powerful, but most important to me, more specific. Instead of the general hand, wrist, shoulder, elbow of my K-Laser Cube, the P4, as you know, has conditions programmed in like epicondylitis, bursitis, plantar fasciitis, etc. I can be much more specific and enhance outcome. What it is not necessarily faster in all conditions, but I am outcome-based and strive for the best result. She was already using a K-laser, which is already short compared to like a class 3 laser. So I add that in there. My laser treatments have always sold themselves with good outcomes. Golfers and tennis players tell their friends. I care for many competitive volleyball players in the area and have trust of many of the top coaches and players. All referrals are generated by good results, and my patients are the walking billboards. My lasers have not at the least paid for themselves, not even now in our pandemic. What is she saying? That even in a pandemic, her lasers are being paid for. Something to think about. When you want to get your practice back up to full speed, you really want to make more money. Let's go back to the finances we were talking about earlier. Let me continue. I will add that it looks impressive on a stand, and many patients comment, "Wow, what is that?" They know even by looking at the P4 that I have the best of the best. Lastly, I have had exceptional service from the K-Laser, now the Sumis team. So K-Laser USA is now Sumis Laser, just to be clear that Sumis used to be K-Laser USA, now they're Sumis. They care about their doctors and ensuring they do things right. Every aspect of my experience with them has been stellar. So, like I say, just as coincidence, just got this yesterday. I've never met Dr. Horston before. Just thought I would share that. And these are the things that I hear back from all the hundreds of doctors that I've spoken with, whether it be at seminars, whether it be emails, and all these doctors, literally from all over the world, they contact me. So, again, I feel very strongly about buying the best laser. I would really like to see, if you're shopping for a new laser, you're looking to move up, I would really like to have you take a look at this laser. And I'm going to show you now some of the wonderful things that happen with this laser. Okay, so let's go over this P model laser. Main menu. New treatment, patient list, custom treatment, administrative settings, performance tracker, video tutorial. If you don't know anything about laser, or even if you do, what's really great about this is that Dr. Phil Harrington is giving tips on treating a whole host of issues. The great thing about this laser is there's 1,300 pre-programmed protocols for you to use. So if you want to review how to treat lower extremity, that type of thing, upper extremity, treatment tip selection, head, sinus, laser acupuncture, the list goes on and on. Head, sinus, jaw. If you're going to be treating Bell's palsy, trigeminal neuralgias, upper extremity, spine, doesn't matter what you're going to be treating. There's a tutorial on here for just about everything. Now, let's go back. Let's look at a new treatment. So let's say we have a patient. Let's say we have a patient come in. This is going to sound a little bit crazy at first. We have this Hispanic lady. Let's say she's got a very petite build. She comes in, she has, let's take a rotator cuff injury that's been going on for 6 months. Okay, so what we're going to do, we're going to take upper extremity. You're going to see shoulder, arm, elbow, forearm, wrist, or hand. We're going to get very specific. Okay, so we're looking at a shoulder. You want general shoulder pain, tendonitis, rotator cuff, joint injury, edema, arthritis, capsulitis, bursitis, AC joint, etc., etc. So this gal has rotator cuff. She is petite. We're going to say small. It's been going on for 6 months. We're going to choose from acute to chronic. We're going to go to chronic. She complains that her pain level in the shoulder is about an 8. Okay, we're going to choose 8 for a pain level. She's pretty dark skinned. She's Hispanic, and we're going to take type 4. Okay, now it's going to take all those variables. Skin tone, it's going to take her pain level into consideration. And now we have the perfect, and I mean perfect, treatment for this very specific condition and also for this very specific patient. So we have a treatment time of 5 minutes. Now, we have peak power of 16.8 watts, an average power of 8.42. It's going to be going through 6 phases of treatment. First phase is going to be 2 hertz, which will be basically for pain. So what you would do is you would hit start treatment. We're going to choose the treatment head, which we're going to choose a 25 millimeter treatment head. So what we do is we take the laser, we put protective glasses on everybody, and all that's required now is we hit the button, okay, and laser will begin. So what we're going to do is do a 5-minute treatment. Now, let me ask you something. 5-minute treatment, that's a very reasonable treatment time. So if the doctor is doing the treatment by himself, 5 minutes doesn't take a whole lot of his time, and he can be right back to adjusting patients again. Let's go back. We're going to hit home. Let's choose another condition. Let's say we have a lumbar disc. Okay, so we're going to go to spine. We're going to go to lumbar. We can go to disc syndrome or disc herniation. Let's call it a disc herniation. And let's say we have a gentleman come in with an average build. Let's say he has an acute lumbar disc problem and his pain level is 9. He's hurting. He's a Caucasian, but he's got a tan. We're going to go type 2, skin tone, same thing. For this particular treatment, and we're talking about a disc, we're looking at a total treatment time of only 5 minutes. So again, we're going to start, we're going to have 15.6 watts, peak power. We're going to have average power, pretty much same thing, 15.6. It's going to start off with continuous wave. We're going to start treatment. We're going to Let's take a 50 millimeter handpiece, okay? And now all those things are factored in: the size of the patient, the exact condition he's there presenting with, and you get to start treatment, and it's only going to take 5 minutes. So we do treatment. We're going to put on our protective goggles. We're going to start treatment. And it's going to start with phase 1, and it's going to go all the way through phase 6. And we have absolutely customized treatment for this gentleman, and I can assure you he's going to respond great, and you're going to have a very, very happy patient on your hands. Let's go back to home again. We can do this with just about any condition. Let's take torso. Okay, let's say we have, let's go abdomen. Okay, these are things that we never really treated much before. Let's say we have a patient who's constipated. We have an average sized man, and he's got this chronic constipation problem. He doesn't have a lot of pain associated with it, but he is uncomfortable. Again, we're going to go skin type 2. So for this gentleman with constipation, he's just really looking for some relief. We have a peak power, 17.2 watts. We have an average power of 8.6. We're going to start off at 50 hertz. So this is going to go through 6 phases with a total treatment time of 4.5 minutes. So again, this is an amazing laser. If you want to do a custom treatment, you got IPF, you can do that. You can go to the treatment. You can, I've got some other things in there too as well, but this is 24 peak watts, an average power of 12 watts, and it's going to start at 15 hertz. So this is just an amazing piece of equipment, and I just am absolutely blown away by all of the parameters in treatment that you can do. So if you're a doctor, even if you've been doing laser for a long time, and you have a laser that say you can't specifically go to specific modulations or that type of thing, here you got it. This takes all the guesswork out of everything. And this is why with this kind of technology, this is absolutely amazing. So we're looking at short treatment times. We're looking at extremely specific things. We've got a meniscus injury, large man. It's acute. Pain level is, let's say, is a 7. He's got rather dark skin tone. Again, now here we go. We're treating this condition. It's going to take 4.5 minutes in the knee. So very reasonable treatment time. No guesswork. We're going to have all the different hertzes. Some of these lasers, if you were to change the hertz, you're going to have to stop in the middle of treatment with the patient, and you're going to have to change the hertz or the modulation or whatever in order to get an absolutely perfect treatment. That's not necessary with this laser. The laser does it all for you. And this is one of the reasons why I am so excited about this laser. It is truly amazing. So, again, good lasers like this, it's expensive, but I'm telling you, you will get referrals. Your patients are going to be absolutely, totally satisfied. You're going to have great outcomes that are consistent. And really, who deserves this laser? As a doctor, you deserve the best, but I'll tell you what, the patient deserves the very best. And this is what you're going to provide for them. So when you're shopping for a laser, I would really like to have you take my advice and get the very best laser there is. You make your own decisions. You may think I'm full of it, and I can't afford a good laser. You're going to go buy a crappy laser. You're going to buy a cheap laser, and you're going to pay for it because you're going to lack referrals. you're going to lack consistent outcomes. But you spend the money on a laser like this, and the money is going to come. You're going to make money on this laser, and it is absolutely truly amazing. So I'm going to conclude my talk. I've been talking long enough. I have a tendency to ramble. I apologize for that. Make sure that you do your homework. It's very, very important that you do your homework, and I've certainly done mine. So good luck to everybody. It was enjoyable talking with you. I appreciate you listening to my opinions, and I will just let it go at that.